A research associate in the lab identified a marker, essentially, on the surface of their cancer cells. Then we made this transition to a new treatment. And that new treatment was a form of immunotherapy, a CAR, T-cell therapy, to treat a subset of rare sarcomas and kidney cancers and breast cancers, and begin to evaluate the safety and the activity of this new medicine in human patients.
Part of the reason why this study is unique is we were able to get patient samples.
Stephanie was the first patient we treated with this medicine. She allowed us to collect blood samples and biopsy samples over an extended period of time, and we were able to ask some pretty deep questions.
It turned out that many of our hypotheses tended to be correct, where the antigen remained stable or our target remained stable. We also learned about some resistance mechanisms in our tumor, also things that we had hypothesized that may happen, indeed did happen.
The piece of data that was one of the most critical for us to understand resistance to therapy was something called spatial transcriptomics data, which is like having the Google Maps of the tumor. So we are able to not just see under the microscope that there are tumor cells and maybe T cells, but we're able to say exactly who is interacting with who, what they're telling each other. It provides so much amazing information for being able to guide development of the therapy for future patients.
Patients do this because they feel they have no other options. In Kent's case, he had lung tumors.
There was no options for operations or radiation, and there was no viable chemotherapy to speak of. And even if the clinical trial wasn't successful, it gave me a lot of distinct hope.
At the 3-month mark after his second infusion, we could see a significant change in the size of the tumor. One of them was over 2.5 centimeters in size, and now it's less than 1 centimeter in size. And there was a smaller one, you could see it on the first scan and barely see it on the second.
It's at the vanguard of immunotherapy development, and that was all done here at the University of Calgary with CHR grant funding, BioCancerous grant funding, Alberta Cancer Foundation grant funding, combined with this generous philanthropic support that we have locally in the community. None of this is possible without their support.
2021 to 2023, as we went from proof of principle, works in a mouse, to treated the first patient with fairly good results for our first try. So that's a testament to what the Riddell Center can do and what we hope to do again and again.